And also, where should I be reporting it if I see it, if I'm someone who's seeing a business or people violating it?
You can report to law enforcement directly to dispatch. This is a Class C misdemeanor. I can't tell you exactly what the punishment is, but it will depend then on the district attorney to decide whether to press charges or not. Law enforcement, local law enforcement can also issue tickets and fines for breaking disorder. So yeah, there are going to be consequences. My suggestion is don't test the system, because we are ready to use law enforcement to the extent it is necessary. Most of all, do this because it's the right thing to do to protect yourself, to protect your parents, if you're a young person, to protect your children if you are a parent, to protect your grandparents if you're a young person, grandparents, to protect everybody you care for.
Dr. Pizzino, earlier today, President Trump was very adamant that the nation needs to be open for business effective Easter. How would you compare your thoughts versus the president's?
I'm not in charge of running the United States of America. I'm in charge of running this community. And so I really can't comment about what plans are going on at the federal level, more than what you hear from the news. As I said earlier, as far as this community is concerned, we will reassess the situation in 30 days and see where it takes us. That's all I can say at this point.
And how are we doing with testing equipment in the county?
Well, as I mentioned earlier, right now there is only one laboratory in Kansas, not just in the county, that can do this test, and that is the State Public Health Laboratory. We think that is going to change. In particular, KU has announced that they are getting ready to start testing probably soon. I can't tell if it's going to be a matter of a few days or a few weeks. It's not going to be months. And in addition, there is now access to national reference labs. I don't know exactly where those tests are conducted. As a matter of fact, I know that some were supposed to be conducted in Salt Lake City, but unfortunately that facility now has been damaged by the recent earthquake, so that's no longer going to be an option. What's really missing is the material to do the test. The equipment, not so much the equipment, but the reagents, the swabs, and I even heard that the paper where the result of the test are drawn by the machine, even that is now in short supply. So, it looks like this situation has taken a lot of people by surprise, but there is a big response going on now. That's why I hope that in 30 days, when we have to reassess the situation, our access to testing will be considerably easier than now.
And how fast are the results coming back? I've heard some people are saying they're getting pushed back by the week.
Yes, they varies. I believe this result for the confirmed case was just a couple of days, but I know that there have been cases that have been delayed by as long as a week. And a week is an eternity in this situation, both from the clinical point of view for the providers who need to make treatment decisions for the patient, but also for the public health point of view, because again, by the time we get the result, that's just old news. That tells me what happened 2 or 3 weeks earlier. It doesn't help me very much.
How does KDHE's limitations on who should be being tested affect Shawnee County? I mean, you've said yourself that there are probably people here who have it. I mean, how does that limit the ability here to find those people?
Well, it's pretty simple. If we can't test people, we can't find who is positive, who is not. And so we just remember the analogy I gave you a few days ago, that it's like being in a dark room, trying to understand what's inside and using your flashlight from your phone. The last few days, honestly, I'm starting to feel that even that phone battery is starting to die. And that flashlight is becoming less and less useful to show me what indeed is inside the dark room and how many rats do we have that infested the room. So those limitations, and I'm not saying that they shouldn't do it. I don't want to be in their shoes. Obviously, if they don't have the material to do the test, then there is nothing that they can do besides working very frantically, and they are doing that, to acquire more. But if you ask, is there an impact from that? Yes, there is an impact, and the impact is we just cannot test the people that we should be testing.
how many people is Shawnee County testing per day? I know we've seen some of the numbers, but
I think the number is going up. I can't tell you how many new tests are done every day because all we know is what we receive back from the labs. So we know the number of negatives and the number of positives, which right now is 0. But I can't tell you when those tests were started, so I really don't know. But I think the number is going up, and the other thing I know is that now about 50% or more, perhaps, is coming back from private labs. So obviously the situation is improving. It's improving still very slowly and not to the point where I would like to be.
The other day it was mentioned that you're going to be reaching out to private labs to see if they'll be able to test for the county and state. How is that going?
Well, yeah, we really don't reach out. We just encourage our hospitals and our providers to reach out. As a matter of fact, I just sent an urgent message to all the licensed providers in the county to give an update on the situation and also ask for their collaboration in securing access for their own practices to private labs, and I gave them the names of the labs that I'm aware of as they are doing the test, and to test as many people as they can have access to in terms of access to lab testing. So that's what we do as a public health department. Then it's up to each hospital or each provider or each clinic to have individual arrangement with one or more of those labs to make sure that they can do the testing for them.
has there been any indication that more test kits are coming to Shawnee County, that we're gonna get more supplies?
The lab said that they were expecting a few more supplies. They received some, I believe, this weekend, and they're expecting a few more, but it's still, I'm not sure. I thought it was just a few hundred tests, so, you know, when we should be testing really thousands of people. It's important, it's, you know, it's better than nothing, but it's definitely not where we should be. But yes, more testing kits are coming.
When are you guys posting the full order online?
It's up now.
I think it's up
At
now.
what website?
It's on the updates page, the COVID updates page in Shawnee County. It'll be on the rumors, the strike team page, and I believe it's going up on
Shawnee County Health Department.
Shawnee County Health Department. Basically, all of our PIs that are working together, they're gonna share that, and it'll be up in its entirety as well.
Can we ask the CEO for the Stormont Vale some questions?
Yes, you may. Please do.
Wondering how many ventilators and isolation rooms does the hospital have at this moment, and are more coming?
So we have, I'm going to get the numbers wrong. I will get them for you.
Okay.
And we'll begin a process of informing the public. Our isolation rooms, we just completed an additional 16 that the 8 were available last week, and the second 8 are coming online tomorrow. And then we're considering whether we need to renovate another 16. The beauty of those particular rooms we added also have a virtual nursing capacity, so we have an ability to communicate and visit with a patient virtually, which will allow us to limit the ingress-egress out of that room and protect our providers and patients that way. So, we'll have the numbers and we'll get them to you, update them regularly. It'll be important to interpret them correctly, because the number of occupied beds will change, and changes constantly. So we'll have those numbers for you. Right now, we don't anticipate a shortage, and we're absolutely monitoring very closely every day, both PPEs and a broad array of supplies, and which include ventilators.
Now, we've heard that some of the hospitals are giving flu and strep tests instead of the COVID test. Are you guys doing that, and can you explain how that works?
So that is a protocol to help preserve the number of COVID-19 tests. So you're looking for a source of fever or infection other than COVID first, that might explain the patient's symptoms, and then reserving those COVID tests for those people that we don't have an explanation otherwise.
And so you're using that to save the COVID tests, and if they have the flu, that would show that rather than having.
We've been following the protocol as published by KDHE, and we soon, however, are going to also be able to test more liberally. Dr. Pizzino mentioned private labs, and we've been in contact with private labs. We are trying to establish our own internal lab. We should have that up and running in the next week to 2 weeks. We too will be limited by the testing supplies, the reagents, all of the things that others are experiencing. Our hope is that those shortages will decrease over time. We'll be able to offer tests more liberally.
The patient who was diagnosed with COVID-19 was a male.
That's correct.
Do we know what age range?
He's mid-50s.
Is he staying at Stormont Vale in isolation? Is that until he tests negative? Is that how that works?
Well, for now, he's in an intensive care unit with a negative flow room, isolation room. So
When does someone get out of the isolation situation, assuming he makes a recovery? How do you make sure that he doesn't still have the virus? How does that work?
So there are protocols established by CDC for when you can discharge a patient, and so that is in flux and updated regularly. So I would just point you to CDC for that guidance.
Do you guys have plans in place to increase staffing should there be an outbreak?
It's an interesting situation currently because given the appropriate stay-at-home and given that we have ceased non-urgent or non-emergent surgeries, so excuse me, we've ceased providing elective surgeries. It's a fact that our business model has shrunk dramatically. So we are delivering just roughly 50 to 60% of the services we had previously. So we have a large number of staff that we can repurpose, and we are constantly evaluating how we can use those people to help staff up should we have an emergency, should we have the need in the hospital. We also are in the midst of standing up a very robust people to be out traveling.
So for whoever might be able to answer this, how is this safe-at-home order going to impact how school lunches will be delivered?
You just go to the school. I go to the meeting, probably no more than I was.
So we're all trying to figure out, how do we answer this one? One of the things that we have been working with the Shawnee County Health Department has been on protocols for individuals to maintain safe guidelines on hand washing, making sure that they are not having contact one-on-one with the individuals. So as long as that volunteer work, and Dr. Pettino's coming because I think there's more, we should be okay with the delivery of the food. Dr. Pettino, am I?
Yeah, I don't have a lot more details, but I know that particularly for Topeka, U.S. District 501, which is the one that has the highest proportion of kids on free and reduced price lunch, they started already last week with a very aggressive program to make sure that everybody will receive a meal. They are using school buses for delivery, they're using their own teachers for delivery, they're using their social workers. I also know that they're planning to start, I believe as early as this week, a fairly aggressive plan for distant learning education. That includes things like, if I understood correctly, and I think I did, having school buses with a hotspot, a mobile hotspot, they can go to area where the school knows there are children that may not have access to the internet. So the bus will go there and be stationed there for a certain amount of time so the students can upload or download whatever they need on their devices, and then the bus can move to another part. So they're really being extremely ingenious, and I don't have a current update from the other districts, but I'm pretty confident that they're really doing everything that they can to mitigate the consequences on the kids.
It won't be like a problem for maybe a group of parents to go over and get their lunches. That's considered something essential, right?
The parents should, right, no, there won't be a problem to receive the food, but they should follow the instructions from the school. Because what we want to avoid is to bring everybody to one or even multiple, but few points of distribution where then you have crowding, and that again defeats the purpose. Yes, Linda has another comment to make. And
good evening. I did want to comment on the childcare section of the order. Childcare facilities that are providing services to employees that are exempted are part of the essential services, and we want them to stay open so our parents that are working in the hospitals and the other essential services can go to work. So there are some guidelines outlined in the order, so we're asking them to read those. If they have any questions, as you know, Shawnee County Health Department licenses our childcare providers in our community, so they can call. Our licensing staff is still working. The number is 251-5750 if they would like some help putting these into place. And again, it's 251-5750. It's really important that we have childcare for the essential workers in our community. And while I'm up here, I'll go ahead and give the numbers for today. We have 17 pending tests. We have 206 negative, and we're monitoring 155 people.
So I would like to make two final comments unless there are other questions. One, piggybacking on what Dr. Kinagi was saying, the sharp reduction in the volume of business that our hospitals are doing, and I know anecdotally that's true also in outpatient clinics. While we want everybody to stay home, we also want people who have an acute health care need to seek medical care. Because one of my many concerns is that by doing all the things we are doing to discourage people from going and seek medical care when they really should. So the last thing we want is for people to die at home from a heart attack because they were afraid to call their doctor or seek the medical care they need. So if it's something urgent, by all means, you should do and seek medical care. It's always best if you call ahead so that the place where you're going is alerted that you are coming, but do not take this order as an indication that you should not seek medical care when it's important. The second and final comment I wanted to make is something that you probably may have seen. It went viral on social media. It's a picture of two healthcare providers next to each other wearing personal protective equipment, and they're holding two signs. And one sign says, "We are staying at work for you." And the other sign says, "You are staying at home for us." And that's really the spirit of this ordinance. Our healthcare workers, I said that before, and I'm not hesitating to repeat it, they are heroes. They are literally risking their lives right now. The minimum that we can do is to stay home for them so that we contain the spread of this infection. Anything you wanted to add on that?
Yes, I would. So, I appreciate you. Appreciate Dr. Pizzino mentioning people that have urgent health care needs. We're open. We will absolutely take care of you. Mentioned a heart attack. Don't call before you come. Come if you're having chest pain. Come for those things that you know are urgent or emergent. And our operations are fully staffed. We're ready to take care of you. And that includes for our clinic. Our clinic volumes have contracted, like I said, but we're taking care of people nonetheless. We just are trying to support this stay at home. And I appreciate your comments about the healthcare heroes. The fact is that all of us have a part in this. All of us have to support the stay at home. All of us have to support our state, county, and local leaders in making these courageous decisions. by doing our best to follow the advice, to follow the orders. So in that sense, we're all heroes in this at the end of the day.
I think I have just one more, I promise, and then I'll be done. I know that Shawnee County already had a lot of rules in place about events and bars and restaurants and what could close. What changes with this stay-at-home order? Can you kind of break down what the difference is between this stay-at-home order and what we were doing before?
Yeah, simply put, the orders before were aimed at reducing gatherings of 10 people or more, right? So that's why we close the schools, that's why we close the restaurants and the bars, and that's why we reduce activities. We close some parks and recs facilities and so on. So there wasn't the group activities. This order goes further than that by saying any kind of person-to-person interaction is now prohibited, except of course for your household members or for the people you need to interact with to take care of your essential needs, and only to the extent that you need to interact with them to take care of your essential needs. So that's a big difference. You are moving from a group situation to an individual situation. You cannot go and visit your friend. This is just not. That's not something allowable under this order.
And what does this order say regarding child care?
The order says that childcare centers can continue to operate if they provide services that enable employees exempted under this order to go to work. So they can't just stay open for everybody, but they can stay open to allow employees. The typical example is the hospital employees, but there are many others. So everybody listed in the ordinance deemed to be an essential, somebody engaged in essential services, they will be covered. However, they need to put in place certain conditions that are described in the order, such as keeping children's groups smaller and other things that you can read in the order. So we are not closing down all childcare centers. We're just limiting their activities to make sure that the people who need to go to work to keep us safe can do so. All right, thank you.
Thank you all for attending the press conference today. We will have another one at 5 p.m. tomorrow. And for the members of the media who are here, I do have packets with the order and the press release. Thank you.